Hello. I want to commend all our first responders and just the amazing community we live in to thank everyone for the continued effort to support our community members as they begin to recover from the tragedy of the storm from the remnants of Ida. Our own internal teams have been stepping up to make sure that we have done everything we can to get boxes and packing equipment and pillows and linens and food trucks, partnered with our colleagues at Naples. And it really is that sense of community and that broader commitment to make sure that when one hurts, that we all step in to try and relieve that pain. And really, that has been the beauty of our communities, the beauty of South Jersey. And honestly, it's comparable to what we've seen during COVID. Our employees, the first responders, are men and women who have been on the front lines, whether it be our grocery workers or our food service folks or environmental services people. They've all just run in. We are seeing the rise in transmission rate. We are over 1 again in New Jersey. The good news of this story, though, is that 11 million doses in New Jersey have been given, and about 70% of New Jerseyans have received at least their first dose. So again, here are our hours. We're offered Monday and Tuesday, and then again on Saturday. We will expand those hours as soon as we hear more from the federal government about the third shot being available to broader than just the immunocompromised populations. But please stay tuned. We, of course, will share that information as soon as we have it. And we certainly appreciate many of you who've come out already to get your third shots, and obviously those that continue to make that very important decision and consider that important decision about getting vaccinated for the first time. Again, our providers stand ready to work with you to answer the questions that you may have, and I encourage you to ask those questions. It's really important that we think about those issues, but nobody can tell this better than one of our own staff. Kathy Vasquez, who received her first dose, was the first employee in the system, and she has some important thoughts that she'd like to share with you today.
A lot of nurses have seen a lot. Last year, our year of the nurse was horrible. I mean, who isn't tired? Who isn't upset? But to that same token, how will anything change if more of us don't get protected? So this is the chance to kind of like look deep within you. You've already seen the signs. You've taken care of these patients that look you in the eye and beg you, please don't let me die. How does that not change your mind? There's so much proof out there that can protect you, because at the end of the day, you're a nurse. People see you for who you are. You're respected. But things won't get better if we don't all come together.
I really am so grateful that our own team members and that many of you have been willing to share your stories, because it really is through those stories that really hit home. And I think as we begin to think about all of the things that we need to do post-COVID, one of those areas continues to be our focus on our behavioral health system and our making sure people have access. September is also Suicide Prevention Month. And it is important for us to make sure that we're providing the resources, which I've listed for you, places that you can go for help. And also that we're just supporting the people who are doing this work, because it really is so important and so hard to make sure that we continue to do all that we can to help address the isolation and depression that comes from some of the issues that we now find ourselves in during this pandemic. I think often about the struggles of the last 20 years. I was so grateful to be able to attend the 9/11 services in Harrison Township. Councilwoman DeLaurentis did a wonderful job of emceeing and really creating the mood and also just the remembrance, not only of those lives lost, but of the rebuilding that happened. Think about the rebuilding that's happened in New York City. Think about the rebuilding of the towers. Think about all of the accommodations we've made to be safe. Getting to the airport early, taking off our shoes, changing the way we pack. Things that 20 years ago you could never have imagined that we would be doing, we've done. Maybe wearing masks is just another one of those things that we do. Because we have to. Because the gift of life, the gift of living in the America that we know and love, is more important than hate. And through that, we will have strength and courage. And we will persevere. Until we meet again, be well and stay safe.